This is Module 4. We will be discussing the rationale for evidence-based practice, define evidence-based practice, describe common ethical issues that might concern nurses caring for their patients in different healthcare settings, and then explain how the nursing process influences clinical judgment while care for your patient across the lifespan.
We will be doing clinical decision-making and evidence-based practice. Evidence-based practice is based on valid published research findings, well-run studies, as you'll notice for your written and discussions. We want it within the last 5 years, and we want it scholarly. It combines assessment findings with results of the research, and the whole reasoning for it all is to improve patient outcomes, and that's the whole basis behind evidence-based practice. And you can look at this YouTube regarding evidence-based practice and nursing research. The process for evidence-based care: you want to identify what the clinical problem is. You need to formulate searchable question. Then you search the literature, which is a literature review. You evaluate the quality of the findings in the literature, and then you integrate your findings into practice. After that, you want to conduct a systematic review where you're formulating the question. You locate the relevant studies that you need, select and appraise the studies, summarize and synthesize any results you've come up with. You interpret the findings, and then you do updates regularly to make sure that you are keeping up with evidence-based practice. Major features of evidence-based practice is its interdisciplinary. Evidence summary: you can translate that to clinical practice guidelines. Provider and organizational factors guide integration. That's an evaluation, and usually it's priority health topics. The utilization of research: the process of synthesizing, disseminating, and using research-generated knowledge to make an impact on or change in the existing nursing practice. So pretty much is you're finding out things just aren't working and you need to find a better way to do it. For instance, where you were doing the backroom reporting, now they have found evidence-based practice has shown that bedside reporting involves the patient, makes the patient feel more part of the team, which also in the domino effect can help with their healing. You also want to critique and synthesize the findings from several studies. Application of these findings is the goal is to make a change in nursing practice. You need to measure the outcomes from the change in the nursing practice, and then you need to research utilization has a smaller focus than evidence-based practice. So it's along the same idea, but it's a lot smaller focus. But in the end, it is along the same way in that we are wanting to look to make sure that what we're doing is in the best for the patient outcome. Why use evidence-based practice? The Institute of Medicine, or IOM, which I know you've heard me talk about before, they are huge on evidence-based practice. They do white papers, always looking at what different healthcare is questionable. They always want to make sure that the patients are getting top quality. They also recommend evidence-based practice as a solution. AACN looks into evidence-based practice. There's magnet recognition status for those that are using evidence-based practice as improving their standards in their patient care. Applying evidence-based concepts. Evidence-based practice is the effectiveness of care which improves when research guides the care. So in essence is you are looking to find ways to improve your patient care, and a way of doing it is researching to see what else out there is being used and working. Evidence-based practice in nursing is the process of moving research into practice. We want to improve patient care and patient and staff safety. It's been shown that a lot of times there is a huge gap from research to practice as to when it's actually integrated into practice, and it can end up being years. And if you ever go on to do your bachelor's or your master's, you will see this fun little acronym. It's PICO, and sometimes it'll be PICOT, P-I-C-O or P-I-C-O-T. PATE, the P is patient population or problem. So with evidence-based practice, you're setting it up. What are the most important characteristics of the patient, um, including the primary problem? How or what intervention, what are you going to do for the patient? Um, Different ones that were looked at could be um, the patient population, patient dissatisfaction, intervention. We're going to change backroom reporting to bedside reporting to make them feel like they are part of it, and to make sure that there's patient satisfaction. So then you're going to compare this to this and see if it works. Here they've got, you're going to decide between drugs, a drug and no medication, or a placebo, or compare diagnostic tests, or doing a group. You could be comparing a control to an experimental group. And then your outcome is, what do you want to accomplish? How do you measure it? What are you trying to do to affect the patient positively? And sometimes they'll have the T, which is in what time frame are you going to be doing it? We have the legal and ethical aspects of healthcare. The blueprint for 21st century nursing. Ethics is a critical part of everyday nursing practice. Nursing in all roles and settings, we must have the knowledge, skills, and tools to uphold our professional values. The use of ethical responsibility as a nurse refers to characteristics of reliability and dependability. So, one of our nursing responsibilities is we need to have a duty to perform actions well and thoughtfully. So, a way for us to demonstrate ethical responsibility is providing competent care. You might want to know that. Ethics in nursing practice overview. Ethics is the study or examination of morality through a variety of different approaches. It can be how we respond to an ethical situation that reflects our core values, beliefs, and character that make you the person who you are, and ultimately the professional who you will become. So look at it this way: even in your professional life, if you're in your personal life, whatever core values, beliefs, or character we have, that is what is also going to show up in us as a professional, or how others will see us. So it is very important to have good beliefs, values, and good character everywhere. Clinical judgment. It's an interpretation or conclusion about a patient's needs, concerns, or health problems, and or the decision to take action or not, use or modify standard approaches, or improvise new ones as deemed appropriate by the patient's response. So our judgment is looking at what is going on, making the decision. Do we take action? Don't we? Do we modify it? Do we improvise? What can we do to make sure that that patient is getting what they need? And this talks about the scope of ethics. There's different type of ethics. There's societal, organizational, bioethics, clinical ethics, research ethics, professional, and personal. We also have morals and ethics. Morals is a broad general consideration of what is good, bad, or right and wrong, and it's based on our values, attitude, and beliefs, where ethics is a systematic study of right and wrong conduct and solutions that involve values and morals. So it's more of a formal process for making moral decisions. So You have your morals, and based upon those morals becomes ethics, and the ethics makes our thoughts or how we um, believe in something makes it so that it's morally right or morally wrong. Now, a dilemma is a situation in which a difficult choice has to be made between two or more alternatives, and they could be equally undesirable ones. So it's not like one is going to stand out and say, pick me. You're looking at two that aren't that best, and how do you decide from there? Then we have the moral ethical agency, the ability of nurses to base their practice on professional standards of ethical conduct and to participate in ethical decision making. Simply means that nurses have choices and we're responsible for our actions. So it means whatever we decide, we better be accountable and responsible for what our decision is. An ethical agent must be able to do the following. We must be able to perceive the difference between right and wrong, understand what abstract moral principles are, reason and apply moral principles to make decisions, weigh our alternatives, and then plan sound ways to achieve the goals. We need to be able to decide and choose freely and then act according to that choice. This assumes both the power and the capability of being able to act in what our decision is. One of the ethical principles is autonomy. So, autonomy is agreement to respect another's right to self determine a course of action. We need to support that independent decision making, a person's right to choose or act on that choice. It's related to the respect for human dignity. Um, Informed consent is based on autonomy, and autonomy also is privacy and confidentiality. So we need to make sure as nurses that we allow autonomy. So if a patient decides they're going to stop doing something, or this isn't in their best, or I don't want to do this, I want to do that, as a nurse, we need to keep any type of beliefs or feelings that we have something, we need to keep that on the back burner and um, support the patient and what their decision is, whether we agree with it or not. Another one is beneficence, showing compassion, taking positive action to help others, desire to do good. It's a core principle of patient advocacy. It is duty to do or promote good. Um, Beneficence stresses the importance of preventing harm and promoting the client's well-being. So we need to make sure that the client's informed with anything regarding the benefits or the negative effects. So that could be chemo, the benefits of having chemo, but what also are the negative or the side effects. We need to be able to give them all the information to be able to make that decision themselves. Another one is non-maleficence. Do no harm, prevent harm. We need to make sure we're doing no harm in the benefit act of using technology to expend life or in using experimental treatments. We need to respect their dignity. Um, Non-maleficence is the use of ability, judgment, or skill to help someone else without causing injury or harm. We need to support the option of not providing further aggressive or invasive treatment that could cause injury or harm. Fidelity, faithfulness, duty to keep promises or commitments, and we need to be fair and truthful. So, as a nurse, we need to keep our promises. We need to do what is expected of us. We need to perform our duties, and we need to be trustworthy in the duties that we are performing. Veracity. We have a duty to tell the truth. We need to be grounded in respect for persons and the concept of autonomy. So, veracity and down to the nitty gritty is it's the principle of telling the truth in a given situation. Justice is obligation to be fair, equal treatment of all patients, equal and fair distribution of resources based on analysis of the benefits and burdens of a decision. So it doesn't make a difference when you're taking care of a patient, whether they're a patient with AIDS, whether they're an inmate from a prison or a jail. You need to make sure that you are treating them no differently than you are treating your mother or your father. And then paternalism is revealing or withholding information based on what is in the best interest of the patient. Decisions about diagnosis, therapy, and prognosis, it can actually be turned into treating others like children. So in some ways it's not good, but it does happen. Then for confidentiality, we have HIPAA, the Health Insurance Portability and Accountability Act, which was started in 2003. Um, One big one in this one is you shouldn't be looking at records unless that is part of your job, or as a nurse that is a patient that we're taking care of. You shouldn't be going in and looking at patients' records on a floor that you are have nothing to do with, um, and you shouldn't be having somebody else do it for you. Informed consent. They're freely giving consent. It's protection for the patient, and it's promoting autonomy. This can be changed either by telling the physician or making changes in writing. An advance directive informed consent ensures the patient gets as much or as little as they wish. A POST form is a provider ordered life sustaining treatment. Um, you see paramedics and first responders using this. It's instructions from your doctor to the emergency responders. It concerns the level of care you prefer if the emergency responders find that you're unable to guide them. So if they find you unconscious or cognitively you just are not able to tell them what you want them to do, this POST form will give them what your wishes are. It should go with you wherever you go for medical treatment. A lot of people will pin it to the refrigerator doors with a magnet um, so that it's easy to be found. Also, make sure that your power of attorney and the like know that you have this POST form. For end of life, you have hospice and you have palliative care. Um, Limitation of treatment. People would do DNR orders. You can have artificial nutrition and hydration, a right to die, brain death, and then with the brain death also you get involved with organ donation. You have euthanasia and assisted suicide. So you have active or passive euthanasia, and you have assisted suicides. Medical futility, interventions that are unlikely to produce any significant benefit for the patient. A quantitative futility is where the likelihood that an intervention will benefit the patient is exceedingly poor, and a qualitative is where the quality of the benefit of an intervention will produce it is exceedingly poor. And then there's some different exemplars that are listed before that you can look at. Now we'll get into the legal issues in nursing. You have this scope of concept. There's legislation, which is the process of introducing, adopting, changing, or repealing laws. Regulation is the process of putting the laws into action. And then litigation is the process of seeking help through the courts to address something that's perceived wrong. For us, the State Board of Nursing is who holds the legal authority for us. And they regulate the nursing practice through establishing the requirements to obtain a nursing license. They issue the license, they determine the scope of practice, they set the minimum education standards, and then if there is any disciplinary that's going on, they are the ones that manage these. And then there's malpractice, which could be tort law or law of medical liability. It's the legal discipline for malpractice. Four elements must be satisfied. There has to be a duty, there has to be breach, causation, and harm. And is a failure to follow the standard of care and is the direct cause of harm. The profession establishes the standard, and this is a unique characteristic of medical malpractice. The most common malpractice claims are failure to assess and diagnose, failure to plan, failure to implement a plan of care, and if they did implement it, they didn't evaluate it. We also have employer-employee liability. It's vicarious liability. The employer is liable for the acts of its employee if the employee was acting as an agent of the employer and the action resulted in injury within the scope. So it doesn't count if you are an employee, but you are a contract or contracted through this employer, then they are not allowable um, because you are considered to be self employed.